Welcome back, everyone. Ready for another deep dive?
Always.
Great. This time, we're focusing on infant growth and development, and we're drawing on a fantastic chapter from a well-respected pediatric nursing textbook.
Sounds good.
Our mission, as always, is to give you, our amazing nursing students and faculty, a deeper understanding of the incredible things happening in a baby's first year of life.
That first year is really remarkable.
It is. I mean, can you believe that in just 12 months, a newborn goes from being totally dependent to, taking their first steps and maybe even saying a few words?
Yeah, and it's mind-blowing when you really stop and think about all the changes that are happening.
Exactly. And speaking of changes, the sheer pace of development is just incredible. Did you know that babies actually double their weight in the first 6 months alone?
It's astonishing.
It really is.
Yeah.
And it really underscores how much is going on, on a cellular level.
Right. It's not just about getting bigger. It's about all the body systems maturing at an incredible rate.
Absolutely. So let's break down some of the key areas of growth and development, starting with the most obvious, physical growth.
Okay, so we know that the average newborn weighs about 7.5 pounds, right? And they measure around 20 inches long.
Right.
But here's something interesting. They actually grow more rapidly in length during the first 6 months compared to the second 6 months of life.
Wow. I didn't realize that. That really puts things into perspective. And what about head circumference? We monitor that super closely with infants, don't we?
Oh, absolutely. Head circumference is a key indicator of brain growth, and those little heads are growing fast.
Makes sense.
And those fontanelles, the soft spots, well, they're essential because they allow for that rapid brain development. The skull needs room to expand.
It's incredible how the body is designed to accommodate that growth.
Okay.
Okay, so we've talked about size, but what about all the internal systems? They're going through some major changes too, right?
Oh, they are. Each system has its own unique journey in that first year.
Right. So where should we start?
Well, let's start with the respiratory system. Newborns are actually much more vulnerable to respiratory issues because of their anatomy.
Oh, that's right.
Yeah, they have tiny nasal passages, their trachea and chest wall are more compliant, and they have fewer alveoli compared to adults.
That makes sense. So as nurses, we need to be extra vigilant in monitoring their breathing, right? Making sure there aren't any signs of distress.
Exactly. Now, moving on to the cardiovascular system. It's fascinating. An infant's heart actually doubles in size during that first year.
Wow.
And their pulse and blood pressure also change as they grow. Their pulse slows down and their blood pressure gradually increases.
It's like everything is adjusting as they get bigger. Speaking of which, I learned something recently that I found super interesting. Newborns are actually much more susceptible to heat loss than adults because their capillaries are closer to the skin's surface.
Oh, that's a great point. It explains why we're so careful about keeping them warm, especially in those early days.
It also explains why we often see things like acrocyanosis, that bluish tint to their hands and feet.
Right.
Or modeling that marbled look to their skin.
Yeah.
It's all because of their immature circulatory system.
Makes sense.
Okay, let's switch gears to the gastrointestinal system. I feel like this one is always a source of fascination and anxiety for parents, right?
Oh, definitely.
Like all the little grunts and groans that often come with a baby's bowel movements.
Oh, yeah. Those can be a bit alarming for new parents, but, it's important to remember that their digestive system is still maturing.
Right.
So infrequent stooling or, grunting during bowel movements is usually totally normal.
So as nurses, we can really put parents at ease by explaining those normal variations.
Absolutely. Of course, we'd want to be on the lookout for any red flags like, hard, dry stools or blood in the stool. But for the most part, those sounds are just part of the process.
Right. Speaking of things parents might not know, did you know that babies are actually born with a higher percentage of total body water compared to adults?
It's true.
It makes them more prone to dehydration, which is why it's so important to carefully monitor their fluid intake and output, especially in those first few months.
Exactly.
Oh, and there's that fascinating thing called physiologic anemia of infancy, right?
Right. It usually happens around 2 to 3 months of age.
Yeah.
It's a natural dip in hemoglobin and hematocrit levels.
Right.
And while it's not usually a cause for concern, it does highlight the importance of iron supplementation during this time.
So those iron-fortified formulas play a really crucial role.
They do.
Yeah.
And lastly, let's not forget about the immune system. Newborns get that initial boost of antibodies from their mothers,
Right.
which provides some early protection, but their own immune systems are gradually developing throughout the first year.
So much is happening. It's amazing how much their little bodies are accomplishing in such a short time. Okay, so we've covered physical growth and the development of different organ systems. Now, what about psychosocial development? That's a whole other realm of growth, isn't it?
It is, and this is where we delve into the emotional and social development of infants. One of the key frameworks we use is Erikson's theory of psychosocial development. Specifically, that first stage, trust versus mistrust.
Right. That stage emphasizes how important consistent caregiving is.
Yeah.
It's all about building that foundation of trust, right?
Exactly. When an infant's needs are met consistently and lovingly, they develop a sense of trust in the world and in the people caring for them.
It makes you think about how their whole world revolves around their caregivers. And those early interactions really shape their understanding of whether the world is a safe and predictable place.
That's so true. And as nurses, we can really empower parents to understand how important it is to respond to their baby's cries.
Right.
To provide comfort and security and really foster that sense of trust.
It's not just about meeting their physical needs, but also their emotional needs. And that sense of trust really lays the groundwork for healthy social and emotional development later on.
Exactly.
Now, I know we also want to touch on cognitive development.
Yes.
Which is all about how babies learn and process information.
Exactly. And Piaget, described this first stage of cognitive development as the sensorimotor stage, which lasts from birth to about 2 years of age.
So during this stage, babies are using their senses and motor skills to learn about the world around them. It's like they're tiny scientists, constantly experimenting.
That's a great way to put it.
Always making new discoveries.
And one of the most significant milestones during this stage is the development of object permanence.
Right, which is the understanding that objects continue to exist even when you can't see them.
Exactly. It's a pretty big deal. Think about playing peekaboo. At first, babies think you've actually disappeared when you cover your face. But as they develop object permanence, usually around 8 months, they realize you're still there even when they can't see you.
It's like a light bulb moment. Speaking of milestones, we also see amazing progress in motor skill development during this time.
We do, and we can break this down into 2 main categories: gross motor skills and fine motor skills.
Okay, so gross motor skills are those big movements like head control, rolling, sitting, and eventually walking.
Yes.
It's amazing to see how quickly babies gain control of their bodies and start exploring the world.
And it's important to remember that gross motor development follows a cephalocaudal pattern, meaning it progresses from head to toe.
So they gain control of their head and neck first, then their trunk, and finally their legs and feet.
Exactly. Now, fine motor skills involve the smaller, more precise movements of the hands and fingers.
So we're talking about grasping a rattle, transferring objects between hands, and eventually developing that pincer grasp.
Right, that pincer grasp is what lets them pick up those tiny objects.
Amazing. And fine motor development follows a proximate distal pattern.
Yes, meaning it progresses from the center of the body outward.
So they start with those big arm movements and then gradually refine their control.
Until they can use those fingers with incredible precision.
It's remarkable, really, when you think about it. It's like those clumsy little hands are transforming into such skilled instruments.
It really is. And, it's amazing to think that all of this, the physical growth, the development of all the different organ systems, the psychosocial, the cognitive, all of it, it's all happening at the same time.
It's mind-boggling when you stop and think about how much is happening in just those first 12 months.
Right. And it really highlights how crucial our role is as nurses.
Absolutely. So let's dive into some of the specific milestones we see in each area, starting with the amazing progression of sensory development.
So those 5 senses, sight, hearing, smell, taste, and touch, they all play a crucial role in how an infant experiences and interacts with the world, right?
And they're not all fully developed at birth, are they? I feel like some senses are still kind of maturing during those first few months.
That's right, like vision, for instance. Newborns are pretty nearsighted at birth.
Oh, right.
Meaning they can really only see things clearly that are very close to their faces.
That makes those close-up cuddles and gazes between parents and babies even more special. It's not just heartwarming, it's actually helping with visual development too.
Exactly. And over those first few months, their vision improves dramatically. They start to develop binocular vision, which is the ability to fuse the images from both eyes into a single 3-dimensional image.
Wow, their world literally starts coming into focus. What about hearing?
Hearing is actually fully developed at birth, unlike vision.
Oh, interesting.
Yeah, newborns can hear a wide range of sounds, and they actually show a clear preference for human voices, especially their mother's voice.
Oh, that's sweet. It's like they're already tuned into that most important sound of their world.
Right, and then you have smell and taste. Newborns have a highly developed sense of smell, and some research suggests they can even recognize their mother's scent. And when it comes to taste, well, they definitely have a sweet tooth.
Makes sense, since breast milk is naturally sweet.
Exactly. And then we have touch. Touch is probably the most crucial sense for newborn communication.
Oh, I can see that. Just think about all those gentle touches, those loving cuddles, and the importance of skin-to-skin contact. It's vital for their well-being, both emotionally and physically.
You're absolutely right. Touch is a language they understand long before they can understand words. And it's really remarkable to see how they respond to those soothing touches. They calm down if they're upset or even become more alert if they're drowsy. It's pretty amazing.
It really shows you how those early sensory experiences shape their interactions with the world. Okay, so we've talked about how they're taking in information through their senses, but what about expressing themselves? Let's talk about communication and language development.
This is where we see that incredible progression from crying to cooing, then babbling, and eventually those magical first words.
It's a journey that's full of both heartwarming and sometimes frustrating moments, isn't it?
Definitely. In those first few weeks, crying is their primary way of communicating, right? It's their way of letting us know they're hungry or tired or uncomfortable.
And those cries can be pretty powerful.
They can. But as they grow, those cries actually become more differentiated. So parents can start to understand what their baby needs.
Well, that's interesting. It's like they're developing their own little language of cries.
Exactly. And then around 2 to 3 months, we start to hear those adorable coos and gurgles emerging.
So cute.
And then around 4 or 5 months, those coos give way to some simple vowel sounds.
Right.
They might laugh out loud or blow raspberries or even just vocalize in response to voices.
It's like they're discovering the joy of making sounds.
Exactly. And then comes babbling, usually around 6 to 8 months. This is when we start to hear them stringing together consonant and vowel sounds like mama or da-da-da.
I love that state.
Yeah.
And even though those early babbles don't have specific meanings, they're still experimenting with the rhythm and intonation of language, which is incredible to think about.
It really is. And then between 9 and 12 months, they start attaching meaning to words like mama and dada, and they begin to imitate other speech sounds.
So by their first birthday, many babies are uttering their first few words with meaning. It's a huge milestone.
It is, and it's important to remember that language development is a gradual process, and there's a wide range of normal variation.
Of course.
Some babies are just chatterboxes right from the start. Others are slower to start talking.
Right. And as nurses, we're there to reassure parents that, as long as their baby is meeting those developmental milestones, there's usually no cause for concern.
Absolutely. Now, while we're talking about variation, we should also consider the impact of cultural and linguistic diversity on language development.
That's a great point. Like babies who are raised in bilingual homes, for example. They might code switch.
Exactly. And it's so important to avoid labeling that as a delay or a problem.
Right.
It's just a reflection of their rich linguistic environment.
It's a great reminder that development isn't one size fits all. So we've talked about how they're taking in the world through their senses, how they're expressing themselves through language, and now let's explore social and emotional development.
Okay, so this is where those heartwarming social smiles come into play. Those early interactions between babies and their caregivers are just so important for their emotional well-being.
Those first smiles are truly magical. And around 3 or 4 months, those smiles become more intentional. Like they're initiating those interactions.
They are.
Smiling and gurgling, just to get their caregiver's attention.
And it's amazing how they start mimicking their caregivers' facial expressions, too, widening their eyes or sticking out their tongues.
Like they're learning the art of social engagement.
Exactly. And around 6 to 8 months, they really start to enjoy those interactive games like patty cake and peekaboo.
So fun.
Right. They're developing a sense of humor and really finding joy in those playful exchanges.
Now, as babies get closer to 8 months old, we often see the emergence of stranger anxiety.
Oh, yeah. And that can throw parents for a loop, especially if their baby has always been happy with anyone.
So those tears and that clinginess when they encounter someone new, is that actually a normal developmental milestone?
It is. It just shows that babies are starting to recognize familiar faces and differentiate them from strangers. It's a sign of their growing social awareness.
So it's not necessarily a bad thing. It's just their way of saying, hey, you're not one of my people.
Exactly. Now, another anxiety that often pops up around this time is separation anxiety. This one can be particularly tough on parents as their baby becomes distressed when they leave, even for short periods.
It's heartbreaking for parents to see those tears, especially when they have to leave for work or even just step out of the room for a moment.
I know, but again, it's important to reassure parents that this too is a normal stage of development. It just shows that they're developing a strong attachment to their caregivers and they understand that they are separate individuals.
So their tears are actually a testament to their love and their growing understanding of the world.
I love that. That's a beautiful way to look at it. Now, before we move on to cultural influences, let's talk about temperament.
Okay, temperament. That seems like a complex topic.
It is, but it's so interesting. Temperament refers to a person's innate behavioral style, basically the way they tend to approach and react to the world.
So some babies are just naturally easygoing and adaptable, while others are more sensitive and reactive.
Exactly. Some are super active, while others are more laid back and observant. And these temperamental differences influence how they interact with their surroundings, how they respond to new situations, and even how they bond with their caregivers.
So understanding a baby's temperament can really help parents respond to their individual needs more effectively.
Absolutely. It's about meeting the baby where they are.
Now, I know we also want to talk about how culture shapes a baby's development.
Yes, it's so important to remember that babies don't grow up in a vacuum, right? They're part of families and communities.
Right.
With their own unique beliefs, values, and practices that influence their development.
So we need to be mindful of those differences and approach each family with cultural sensitivity.
Exactly. We should be asking questions, really listening, and tailoring our care to each family's individual needs.
Can you give us some examples of how those cultural practices might actually influence infant care?
Sure. For example, some cultures have specific beliefs about, say, the hot or cold nature of foods and how those foods can impact a baby's health. Or they might have traditional practices related to soothing a baby or even how they arrange their sleep environment.
Right, so many different approaches. It's a reminder that we need to be open-minded and respectful of those differences.
Absolutely. Our role is to provide evidence-based information and guidance, but also to honor and respect those cultural traditions.
It's about finding that balance between tradition and modern medical practices.
Exactly. Now, speaking of promoting healthy development, we have to talk about play.
Play. It seems like it's just fun and games, but it's so much more than that, isn't it?
It really is. Play is essential for learning and development. It's how babies explore their environment, experiment with cause and effect, develop their motor skills, and really exercise their imaginations.
So it's actually like work for them.
It is. And as nurses, we can really encourage parents to provide lots of opportunities for play, offering age-appropriate toys and activities. We can also encourage them to get down on the floor and play with their babies.
Right. It's recognizing that play is not a luxury. It's a vital part of their development.
Right. And speaking of things that are crucial, let's talk about early learning.
Okay.
Early learning encompasses so many things. Reading to babies, singing to them, exposing them to language, even before they can talk.
Yeah.
Research actually shows that those early experiences with language and literacy really lay the foundation for later success in school.
It's amazing how much of an impact those early interactions have. It's never too early to start, right?
Never. Even newborns benefit from just hearing their parents' voices.
It's like planting seeds that will blossom into a love of learning later on.
Exactly. Now, speaking of planting seeds, let's talk about healthy eating habits.
Ah, yes, nutrition. Providing those little bodies with the fuel they need to thrive.
Exactly. So we talked about breastfeeding and formula feeding, but as babies grow, we can help parents navigate that whole introduction of solid foods.
Right, that transition is so exciting and often pretty messy.
It can be. But we can make it less daunting by educating parents about the signs that their baby is ready for solid foods and discussing the best first foods to offer and how to introduce new foods safely.
So things like starting with iron-fortified rice cereal and then gradually introducing other foods one at a time, being careful about allergies.
Exactly. And there are certain foods we want to avoid in infancy, like honey, cow's milk, egg whites, and anything that's a choking hazard.
So things like grapes and hot dogs are definitely off the menu for now.
Right. Those foods can be dangerous for babies who don't have the chewing skills to handle them safely.
It's like a culinary minefield out there.
It can be, but with the right guidance, parents can feel confident.
Okay, let's talk about sleep.
Sleep, or maybe the lack of it.
Right.
Sleep deprivation is pretty common for parents of infants, but we can offer them some practical strategies and reassurance.
So what are some things we can discuss with parents about infant sleep?
Well, we can start by just explaining those normal infant sleep patterns, which can be all over the place in those first few months.
Right. Newborns sleep a lot, but they also wake up frequently to feed.
Exactly. But as they grow, their sleep patterns start to change. They sleep for longer stretches at night. Around 3 months old, many babies are sleeping for like 7 or 8 hours straight at night,
Wow.
with a few naps during the day.
And by 6 months, most babies are sleeping through the night.
Right. So, we can really play a key role in helping parents establish good sleep habits for their babies.
Like a consistent bedtime routine, creating a calm sleep environment, and teaching them about safe sleep practices.
Exactly. And one of the most important things is to always place babies on their backs to sleep.
Right. Back to sleep has been a game changer in reducing the risk of SIs.
It really has. Now let's move on to another important thing. Promoting healthy teeth and gums.
Yeah, we don't always think about dental care for babies, but those tiny teeth need attention too.
You're absolutely right. Even before those teeth erupt, it's important to just wipe a baby's gums with a clean, damp cloth after feedings.
Well, that's a good tip.
Yeah, just to remove that milk residue.
And then once those FERV teeth start coming in, we can switch to a soft bristled toothbrush.
Exactly. And it's so important to avoid sugary drinks or letting them fall asleep with a bottle.
Right, that can lead to tooth decay.
Exactly. So no bedtime bottles or juice in sippy cups.
Got it.
And ideally, babies should have their first dental visit by their first birthday.
Oh, okay. Let's talk about discipline.
Okay. Discipline is essential, but it's crucial to approach it in a way that's both effective and developmentally appropriate.
So no spanking or harsh punishments for babies.
Absolutely not. Infants are way too young to understand the connection between their actions and punishment. We should focus on positive reinforcement, redirection, and setting clear boundaries.
So it's about teaching them what to do, not just punishing them for what they shouldn't do.
Exactly. It's about guiding them firmly but lovingly.
Now, switching gears a bit, let's talk about the realities of modern family life. The need for childcare outside the home.
Right. Many parents work or have other commitments, so they need to find childcare for their baby, and that can feel overwhelming.
It can. So how can we, as nurses, support these families in those decisions?
We can provide them with information, like discussing different types of childcare, giving them resources to help them find licensed providers, and talking about their anxieties about leaving their baby.
It's about empowering parents to feel good about their decisions.
Absolutely. And we can also advocate for policies that support access to affordable, high-quality childcare for everyone.
Yes, so important. So we've talked about so many aspects of infant growth and development, from those early reflexes to language to social skills. Now let's get into some of the specific strategies we can use as nurses to promote healthy development.
So we've talked about a lot of really important stuff so far, but, what are some concrete things we can do as nurses to help families during those early months to make sure their babies are thriving?
Right. What are the practical strategies?
One of the most valuable things is providing anticipatory guidance.
Anticipatory guidance.
Yeah, it's basically about equipping parents with the knowledge and tools they need so they can feel prepared for, whatever's coming next.
So we're talking about things like discussing upcoming milestones, potential challenges, that kind of thing.
Exactly. And providing strategies to support their baby's growth.
Right.
It's not just about giving them a list of facts, but helping them really understand what to expect and how to best support their little one through each stage.
So it's like fostering a true partnership. Nurses and families working together to ensure the best outcomes for the baby.
Exactly. Now, to really bring this all to life, let's look at some common nursing diagnoses that relate to infant growth and development.
Okay, that sounds helpful. What are some that we might see?
Well, one that comes up frequently is breastfeeding difficulty, which can be caused by a number of things. Things like the parent not having enough information, or the baby not suckling well, or even just, anxiety on the part of the mom.
Right. So many factors can play a role. So in this case, our goal would be to support both mom and baby so they can breastfeed successfully.
Exactly. So we might teach the mother how to recognize her baby's hunger cues, show her different positions for breastfeeding, assess the baby's latch and how they're suckling, and just, provide reassurance and emotional support. It's really important.
It's all about addressing the underlying cause and helping that mom feel confident.
Another common diagnosis is desire for improved nutrition, which might be related to the caregiver's desire to enhance their baby's nutrition.
Right, so they're motivated and ready to make some changes. So I guess in that situation, our goal would be to help the baby show adequate growth and, like, appropriate feeding behaviors.
Right. We would want to actually observe the feeding process, provide education on proper techniques for breastfeeding or bottle feeding, talk about when to introduce solid foods, and, of course, track their growth to make sure things are going well.
It's a really holistic approach, taking the baby's individual needs into account and supporting the family as they make informed decisions.
Absolutely. Now, let's look at a diagnosis of alteration in nutritional status, which, is related to insufficient dietary intake.
Right, which could happen for a lot of reasons, like feeding difficulties, medical issues, or even just parental worries about food.
Exactly. So our goal would be to make sure the baby is actually getting the right nutrients to grow and develop. So we might adjust how often they feed or how much they get at each feeding, introduce solid foods when appropriate, or even recommend things like supplemental formula.
It's like being a detective, isn't it? Figuring out the root of the problem and then coming up with a plan.
Exactly. Okay, switching gears a bit, let's talk about altered attachment risk.
Okay.
This diagnosis could be related to, things like the baby being premature if the parents are using substances, or even just a lack of knowledge about those early infant cues.
Right. So in that situation, our main goal is to foster a healthy, secure attachment between the parent and the baby.
Exactly. We might assess how the parent responds to their baby's cues, encourage things like eye contact and being close physically, teach them about infant development and communication, and just offer a lot of support.
It's about really strengthening that essential bond between parent and child. It's so foundational to their well-being.
Absolutely. Another one we often see is delayed growth and development risk. This can be due to things like prematurity, a chronic illness, or even just factors in the environment.
So our focus there would be on maximizing the baby's developmental potential.
Right. We might do things like developmental screenings, provide early intervention, suggest toys and activities that are appropriate, and even collaborate with other specialists.
Right. It's like developmental specialists, physical therapists, that kind of thing.
Exactly. It really takes a village.
It does. Now, here's one I think is so important to address. Caregiver fatigue risk.
Oh, yeah, that's a big one. Because when caregivers are exhausted, they're not going to be able to care for their babies in the best way possible.
Exactly. And parenting is so demanding, especially those first few months with the sleep deprivation and everything. So how can we help those caregivers who are struggling?
It's all about education, providing reassurance, and offering practical strategies. We can talk about normal sleep patterns for babies, give them tips on creating routines, remind them to prioritize self-care, and even connect them with support systems.
It's such a great reminder that taking care of the caregiver is just as important as taking care of the baby.
Absolutely. And lastly, we can't forget about injury risk.
Right. Babies are naturally curious, and as they become more mobile, their risk of injury goes up.
It's true. Our main priority as nurses is to keep those little ones safe, so we can educate parents on things like car seat safety, how to childproof their home, teach them basic first aid and CPR, and just constantly emphasize supervision.
It's about making sure that environment is safe for them to learn and explore.
Exactly. Well, we've covered a lot of ground today, but I want to leave you with this. We've taken a deep dive into infant growth and development, and I think it really highlights just what an incredible journey those first 12 months are.
It's really inspiring to think about the role we play as nurses in supporting these babies and their families through such a transformative time.
You, as nursing students and faculty, have the knowledge, the compassion, and the skills to truly make a difference in their lives.
And don't forget the power of those small gestures, those simple things like a warm smile, a listening ear, and a few words of encouragement.
So that wraps up our deep dive into infant growth and development. We hope you found it useful.
Thanks for joining us, everyone. And until next time, keep those minds curious and those hearts caring.